my name's Holland. Welcome to this, the first video in a couple of videos I'm going to be doing to show you how to treat your own knee. This video is going to contain the basic elements, and they're usually the basic elements of what's known as Swedish massage, and I use these to begin with, and then I have developed them to really encourage the movement of blood and fluid in the leg so that you get the maximum benefit from the work that you do. So let me just explain my philosophy. I ran a clinic treating old injuries for 14 years, and this was as a result of having an injury to my leg from being driven into by a car. So I learned firsthand quite a lot about how to get the fluid moving correctly in a knee that's mending. And so what I did was then develop that into my treatment of other people. I did some professional training too, but the information I gleaned from treating myself and from understanding what it's like on the inside has been very beneficial. And to put it really, really succinctly, the amount of healing that you can expect is a direct consequence of the amount of blood that you can get to flow through the area, bringing oxygen and nutrients to mend the damaged tissue. So apart from removing the damage, bringing in the oxygen is the most important thing that you ever need to think about. And this is not something that's generally known. So what I'm going to do in this video is to demonstrate the general practical strokes, which are known as effleurage, which is flushing, and petrissage, which is kneading, and tapotement, which is tapping. And then I will just show you after that some of my variations on those basic strokes, because if you only do these strokes, you will notice improvement. In the next video, I'm going to show you specific areas that you'll need to work on depending on where your pain is, and specific muscles, where they're attached, and also some swinging and gravity stretches that will help you to recover faster. So let's go. First of all, let me explain why I'm sitting on the floor. I'm doing that because everybody has a floor, and it's no good me showing you how to do things on a bench if you don't have one. And I'm wearing my cycling shorts because that makes it easier to get at my leg. The fewer clothes you can wear, the better. And obviously, if you're in the privacy of your own home, you can wear nothing at all if you want to. I'm using a food grade safflower oil. It really doesn't matter what you use, but that's the one I've been using and find it soaks in the best, and it also is the thinnest for moving easily over the skin. Okay, so beginning with flushing, this is the area that you're generally going to be working if you've got injuries on your knee, not forgetting lower down the leg and the back of it. So with the flushing of the leg, and I know we're only working on your knee, but you need to get blood flowing through your whole leg. These are the areas that I will work on to start off with. So I go right from the ankle up to the hip, and even as close to this bone here as you can. Okay. So to begin with, it is a warming up, softening, getting the blood flowing, and do it fairly firmly because you're trying to get the blood flowing through the muscle as well as the skin. Okay. And this is something that's normally done pushing this way if you're working on somebody, so it's quite difficult to do it on yourself because you're pulling towards yourself. And the way that I get around that is to use my forearm. It's much easier to get some pull if you use your forearm rather than your hands for these movements. So going right up as far as you can, as close to your hip bone as you can get. And if you've got injuries in this area, you may well begin to feel them as you start to put a bit of pressure on. But it's not meant to be very hard. I turn my arm this way so that you can get to this side, the inside of the leg, and I turn it this way to do the outside of the leg. So covering the area as much as you can, assisting your arm if you need to. This is the basic flushing stroke done in a slightly unusual way because you're doing it to yourself and you're pulling towards yourself. But that's the beginning. Now the next stroke, petrissage, the kneading, I will show you on this part of your leg here. So you grab a good chunk of flesh from just behind the knee, as close to the kneecap as you can, and then you move up, holding the flesh between your fingers and your thumb and right the way up to this bone. And the next time you do it, you're deliberately pulling the muscle away from the bone. So you're grabbing just a little bit more tightly and deliberately. Okay, and then you do the same thing for the muscle on the inside. So this is including quadriceps and adductors on the inside of the thigh here. And I'm going right up to the pelvis and the outside. So you're doing the first row, which is squeezing the muscle, and then the second is pulling that muscle away from the bone. And I think I forgot to do that on this one, so I'm going to go back and pull the muscle away from the bone on this one. And then the next stroke is running your thumbs towards your fingers. And I'm showing you this way, even though I wouldn't normally do it this way around, because I want you to see that you maintain finger contact while you're rubbing the thumbs across. And then you do it. That's the way I would normally do it. But the second time, what you actually do is pull your fingers towards your thumbs. So you're going the other way. And then you do that as far as you can. On the outside, thumbs towards fingers. Just do this quite firmly. And you will notice soreness in the muscles where they're injured. So what you're trying to do is to loosen the muscle fibres and get some fluid flowing through them. And the last part of petrissage is this kneading movement. I'll show you it the other way around in a second so you can see fingers moving across towards the thumb, then the other hand coming in front of it and doing the same thing, and then finally on the outside. Okay, and that's petrissage. You can see my legs getting a bit pink from all that work. And the last stroke is tapotement, which is the tapping. And you can do it with your fists closed. And the movement is actually a lifting movement. Can you see? Not a thumping. It's not what you're doing. You're tapping and pulling away as you do so. This will make your leg even pinker. And you go all the way around. And then on the inside. And this is covering all the muscles that could be indicated when you're working on a knee problem. The quadriceps are actually attached here at the top of the tibia below the kneecap, and the quadriceps tendon encapsulates the kneecap, so we work right down to here. And you can also do tapotement like this. Okay, now to work, if you have pain at the back of your knee, it might be due to the gastrocnemius muscle. So I'll just show you the same strokes for the gastrocnemius. This is the belly of the calf. There are a number of muscles underneath the gastrocnemius as well. Soleus is under there, and then all of the flexors from the toes travel up the back of here, and tibialis posterior, and they're attached between the two sides of the belly of this muscle to the tibia at the back there. So doing the same thing, you have effleurage and petrissage. I do like this with my hand either side, moving across and moving across, petrissage, And the kneading you can do like this. And depending on how flexible you are, you can lift your leg up and do the tapotement from the back. It's all difficult to get it regular though. Okay, so that's the first basic techniques to show you for Swedish massage if you want to treat yourself. I hope that was useful and helpful. And in the next video I shall go on to show you how to treat specific problems and pain that you may have in your knee. Thank you for watching. Goodbye.